Thank you for leaving the traditional system. And one thing I will tell people about this, and I say it all the time. Fortunately, Jan and I have been out of the traditional system for over 21 years. We have not billed any kind of insurance in over 20 years because I think that's where the corruption lies.
Yeah.
Because if you bill any kind of insurance, it is somehow related to the government because they are told what to pay, whether it's private insurance or government insurance. They are so heavily regulated by the federal government. They're told what to pay, what price, and what to pay for. So if you are in the healthcare system and you are billing any kind of insurance system, you are owned by the federal government, period. And I have friends that are in the system, and I don't think that you can ethically practice as a doctor, a pharmacist, or a nurse in a traditional system with ethics. Just like you said, there's protocols that are killing people, and you know it. I know that my friends are smart guys in pharmacy. I know they're smart people. But unlike you, they don't have the guts to say, you know what? I've got a mortgage. I've got house. I've got kids. I've got to make this income. They don't have the guts like you do, or the faith.
I hear that all the time. I hear people come up to me all the time like, "Thank you so much for what you do. I wish I could do that, but I have a mortgage and I have family." I'm like, I had all of those things too.
Right.
I think people don't realize that, we have had the power all along. The power lies with the people. And as nurses, I feel like we could have stopped this very early on if we had just stood up and said no. Like the moment that they told us our patients could not have an advocate at their side, we truly should have stood up as a profession across the board and said absolutely not. And I feel like we could have saved so many lives just by doing something as simple as that. And when I came out with Nurse Freedom Network, I started looking around. I was like, this is great. We have this platform. All of the nurses are going to come and we're going to stop all of this. This is great. And I'm looking around and I'm like, okay, where's everybody? There were very, very few nurses that were coming forward. More and more are now waking up to what's happening and are joining forces. And they're ready to get out of this system. But so many, I can understand. My child is grown. I'd like to think I would do the same thing, even if I still had my child at home. But I don't know. I don't know what decisions I would have made differently if I still had a child to support. But I think a lot of nurses don't even understand that they don't have to be a hospital employee. There are so many other things that you can do with your nursing license that will focus on keeping people well. That's what we wanted to do with Remnant Nursing.
Yep.
It's not, and it's the benefit of it is twofold because we are, while we're providing this true patient-centered care, we're also creating opportunities for nurses to break away from this broken and oppressive system. So I'm really, really excited to see where it's going. We have 100% positive feedback from our clients who are receiving this exceptional level of service, and they're noticing the difference right away. And then the nurses who are able to provide care in a meaningful way while still creating income for themselves, it's just a win-win.